Hello friends, Chacruna followers, here we are again in our live interview series, reporting from Mexico City from the launch of our Drugs, Politics and Culture Collective. We are in the Pulqueria Insurgentes. It's a great, wonderful party. I'm so happy to be here. I love Mexico, and we are full of friends and good vibes and good ideas. We had a great presentation, and we're also talking a lot about our conference, Sacred Plants in the Americas, which is upcoming in Ajijic, February, in the state of Jalisco, from the 23 to the 25 of February next year. It's an entirely free conference with over 150 speakers in 4 simultaneous tracks. And I'm here with a dear friend of mine and a colleague, Anya Loizaga-Velder. And she's German-Mexican, and she's a psychotherapist. She's a PhD. She has wrote a thesis about the therapeutic potentials of ayahuasca in the treatment of addictions. And she also works with clients that have problematic use of ayahuasca in her center, Nierica, in the interior state of Mexico. A very beautiful spot. I've been there twice. And I admire Anya a lot, and we have known each other since long ago. Anya, thanks for being here. And perhaps you can just start by telling people a little bit about your research, your PhD.
Yeah, my PhD was about understanding what are the therapeutic mechanisms of ayahuasca for addiction treatment. What are those turning points that help people to change their life and overcome an addiction, and also to understand why it works in some people and why it does not work in others. So what are those factors that need to be there for people to have a successful outcome in the treatment?
How long have you been studying this topic, Anya?
For about 10 years now, because after the PhD thesis, we were continuing the work, observing other people. We did a similar study also with ayahuasca and eating disorders, which was very interesting to find so great similarities in what people report, what was helpful for them. And
yeah, this study about ayahuasca helping people with eating disorders got a lot of visibility in the media, got a lot of good attention. But just like to summarize for our audiences, do you think that ayahuasca really can help people that are suffering with problematic alcohol and drug problems?
Yeah, I think we need to be careful with the pharmacological fantasy that we have found a cure for addiction, because there's none of this. Like there's no one single medicine or drug that can take an addiction away. But I do think that ayahuasca can be a catalyst, like really helping people to understand why they get into the addiction, also finding the strength to get out of it, or getting such a spiritual experience that transforms their life. So it can be a catalyst for transformation if there is a good context, if there is clear motivation, clear intention, and ideally also some follow-up, like in restructuring the lives of people.
Have you witnessed firsthand a lot of people getting really better by doing this kind of treatment?
Yes, if ayahuasca is administered by a skilled facilitator who has also really like an in-depth knowledge about the psyche and the sensitivity to guide people along. And people are well prepared for the experience, and some are accompanied after the experience. Yes, some people have really transformative experience. I say some because for some others it does not work.
Why doesn't it work? You mentioned that you think that maybe some kind of people it works and other it doesn't work. Is there anything you can share about that?
Well, I think on the one hand is the social context they live in. If in their social context there's a lot of stressors, if there's a lot of family stressors, or stressors in the environment, and they go back to an environment where a lot of drugs are consumed, the alcohol is consumed, it's much more likely that they relapse just after, with other treatments. So they really need to make a complete life change. And so it depends which support they get to do this life change.
Well, I want to say that I find it refreshing, this kind of discourse, because we also hear a lot of messianic claims about ayahuasca being a kind of magic pill or panacea to solve all problems in all conditions and all situations. And what we hear now is the words, first-hand words from a true expert that has done really a lot of ground empirical work, attesting both to the benefits but also to the limitations. And I want to also jump into, I know you have been trying to do a kind of research here in Mexico, and you have been facing a lot of bureaucratic challenges. Can you tell us a little bit about that?
Yeah, we wanted to implement a controlled study. We actually have the protocol that got approved by the Committee for Ethics and Research of the National Autonomous University of Mexico, the medical faculty. Unfortunately, we struggle with permits by COFEPRIS, which is the authority for controlled substances. So it has been many bureaucratic burdens to try to implement this protocol, unfortunately, which is a pity, because this would be really needed to know how effective ayahuasca is and really understanding how we can support people better with ayahuasca for overcoming an addiction.
So from what I understand, you managed to pass a first phase, which was getting approved by the INB, so like the ethical board, but you didn't get permission by the health agencies to actually conduct the study. Is that correct?
That's right. We still have not given up. We're working on it, but it's really a lot bureaucratic work, and probably a lot of money to get all those permits, and a lot of patience.
How many years have you been trying to do this research? Because I remember you talking about it since a long time ago. How many years are you actually that you've been involved in dreaming up in this research?
The clinical research now for 4 years, and it has been a little bit over 1 year that we got the approval from the ethical and research review board.
So this is a typical example of the schizophrenic drug policy international regime, because this substance, the so-called Schedule 1, are considered substances of highly potential of abuse and no medical use, and you could theoretically have a permission for study for scientific reasons, but in practical terms you can't get the permits and you can't do the studies, and without studies you can't claim that the substances have therapeutic effects, and you can't change their classifications as Schedule 1. So this is a typical example of a catch-22 situation where you're stuck in a very burdensome and life-wasting energy trying to conduct research like that. So I want to congratulate you for your persistence and for your efforts, and all the international community is behind this initiative. Anya has presented on several conferences, but just let's wrap up about talking about a subject that has perhaps even less attention, which is the maybe not so positive or integrated use of ayahuasca. You have mentioned that you also think that people can use ayahuasca problematically, and that is kind of unconventional in our circles to hear. Can you talk a little bit about that?
Yeah, unfortunately, with increasing popularity of ayahuasca, there is also many facilitators who are really not completely prepared to guide people through the experience. So, especially about the claim that ayahuasca can help people to overcome depression, addiction, anxiety, etc., attracts people who have severe trauma in their childhood or other more complex psychological situations. So ayahuasca is a facilitator for psychological process, so sometimes those processes come up within a ceremony, and if the facilitator is not prepared to contain this experience, it can lead to a re-traumatization. Like instead of resolving the trauma can become worse in the sense. So unfortunately, we have treated some people who had like severe psychological disturbance after an ayahuasca ceremony that was provided by a guide that was not sufficiently skilled to deal with those situations. So some people, like, they manifest like anxiety or sleep disorders, or deep depression, or even suicidal thoughts. So we call it like a post-ayahuasca stress disorder in some sense. So I think
Post-ayahuasca or past-ayahuasca?
Post-ayahuasca stress disorder.
Is this an expression you invented?
Yeah, because we observed those symptoms to be really similar to post-traumatic stress disorder. And some of the people, they did not suffer from post-traumatic stress before going to the ayahuasca ceremony. So it was the ayahuasca ceremony that brought up maybe a childhood trauma or whatever that was not contained, and that really provoked those syndromes in the people.
And in your experience and in your therapeutic work, is it possible to get people back to having a healthy outcome after having such a crisis?
Yes, if they get assistance from an experienced psychotherapist or an experienced therapist sensitive to help them to transform this healing crisis into growth. I find like any crisis is an opportunity. Unfortunately, if these crises are then channeled to people who have no knowledge about ayahuasca, or they're not sufficiently skilled to deal with trauma, etc., it can become more complicated.
Well, I thank you for your courage to speaking out on this, and I also appreciate the clinical work you have been doing. And this is a good example about how we should treat drugs in a balanced way, in a way that takes into account both risks and benefits, and not try to go for either satanization or demonization, or on the other extreme just glorification, and to have a messianic view that this is going to be the ultimate solution about everything. This topic demands a lot of delicate care, a lot of good reflection, and it's important for us as researchers and as people that care for these substances to think about these things thoroughly, and to help cultivate a community, a space of care, a space of compassion, a space of sharing safely our findings and our experiences. And I just would like to ask Horacio, our guy behind the camera, to show a little bit what the party we are in, and to say that it's so nice to be here with all these wonderful people in a pulqueria, traditional pulqueria of Mexico City. Keep on tuned, keep with us, and keep on join us in the conference in Ajijic. Come join, see Anya's presentation and all of us. To be continued. Big hug from Mexico City.